program coordinator, monitoring surrogacy programs. I'm also the egg donation program coordinator in the BioTexCom clinic. So let's start. Let's have a general information as to the egg donation program. This is actually, if you send an email to me with the inquiry regarding egg donation program, I'm sure you receive some general information, as you see on the slide, that we have been working in this area with the egg donation and IVF programs for more than 10 years already. We have the wide range of egg donor database. We have about 500 egg donors, and the egg donor database is monthly updating, so I believe it's impressive a little bit. We carry out about 900 to 1,000 egg donation programs per cycle. Also, very important factor is that we do not have age limit, but only health limit. But I will talk a bit later.
For the intended mother, for the recipient,
absolutely,
for the mother recipient.
For the recipient, absolutely. We carefully screen all our egg donor and sperm donors according to the highest European standards. So, all our egg donors and sperm donors that are in our online egg donor database, before getting to this database, they undergo the whole list of medical examination required by the European standards, by Ukrainian standards, in order to become the egg donor. And 70% of our egg donors hold college degree. So, stages of egg donation program. The first stage is picking a date for the initial consultation. Actually, the first stage, I would say, the sending an email to me, and then we'll pick up the date of initial consultation. Usually, how it goes step by step. The client sends me an email with inquiry regarding information as to the egg donation program or IVF program, and we discuss all possible steps and what is required in order to start the process in our clinic. Before setting up the initial consultation date, I need the following documents from your side, such as transvaginal ultrasound report that has been done no later than 6 months. I also need breast ultrasound report or mammography. Some of the clients may ask why we need breast ultrasound report. This is the requirement of our doctors, since as you'll be a carrier of the baby, you'll be breastfeeding in the future, we need to make sure that there is no any suspicious nodes or cysts that can put under risk your health in the future. We also need chest X-ray for both you and your partner, and we also need a doctor's certificate that you are healthy enough to carry out the baby. And in case of IVF program, we also need a statement that hormonal stimulation is not prohibited for you. And sperm count of your partner if available. In case it's not, anyway, you will be coming for the initial consultation, and semen analysis will be conducted in our clinic. So after the initial consultation date is set up, you come to our clinic to undergo medical examination. For the woman, for the carrier, that will be the list of medical examination prepared by our doctor, despite only it will be pap smear, serology test, and another hormonal tests that are required by the doctor, taking into account your medical history, etc. For the husband, it will be serology test, hepatitis B, C, syphilis, HIV, and that will be karyotyping test. During initial consultation, we will have the appointment with the doctor, during which she will evaluate your chances as to the program, since our doctors are very transparent and very clear and straightforward. The woman will have the ultrasound done, and after that, after discussing all possible questions as to the treatment, protocol, medications, the doctor will make the treatment plan for you. Also, the partner, in case, the partner also will have semen analysis done, and in order to sign the contract in our clinic, you will need to get the authorization from 2 specialists in our clinic. This infertility specialist, and this is our embryologist. Also, after everything has been discussed and the doctor and after doctor's discussion, she prepares a treatment plan for you, and we discuss the possible dates of your arrival, because some of the clients would like to have this schedule beforehand regarding the next visit. Some of the clients ask me, what is the time frame between first visit and second visit? I cannot tell you for sure. It depends on the treatment plan made by our doctor after initial consultation already. And then, of course, we take into account your schedule preferences, we take into account your work commitments, and then we try to do the best treatment plan for you we can. Please, guys, be ready to spend the full day in the clinic, as Anastasia explained, because it is the same as for the surrogacy programs and for the egg donation programs. Initial consultation takes 1 full day for the medical examination, consultation with the doctor, discussing the contract, obtaining medications, explanation regarding those medications, because there are special instructions to be followed as well. Let's move forward. After everything has,
Does this thing happen over a weekend? Can you do that on Saturday, Sunday?
we can do it on Saturday. We do not work on Sunday. Yes, on Saturday we can do it. After the initial consultation is accomplished, we sign the contract, you obtain the medications, and you come back to your country. After that, the treatment plan starts. Usually, as to the egg donors, we will talk a little bit later, because before starting the treatment, we need your egg donor selection. If you talk about egg donation program, of course, you have time to select the egg donors, as Anastasia mentioned before. I recommend you selecting up to 5-6 egg donors in order of preference. This list will be given to our doctor, and then the treatment plan takes place. From our side, we prepare the egg donor, and from your side, we also preparing you at the same time simultaneously, because we will be synchronizing both you and the egg donor. So the client is to follow all the treatment instructions according to our doctor's prescription. Please be ready to undergo a few ultrasound procedures in your country as well, because before coming here, before second visit, you will need to undergo at least 2 ultrasounds that will be required by our doctor before coming for the second visit for the egg retrieval itself. So when the date of your second visit is determined, you need to come to Kyiv for the embryo transfer procedure. Usually our clients come at the day of egg retrieval, because on the day of egg retrieval, the client has the ultrasound done by our doctor. And from the date of egg retrieval, the client starts using progesterone medications. And for the progesterone medications, the injections are included. And our medical staff will provide the nurse for you, who will be assisting you and who will be doing injections during your whole stay in Ukraine. Usually the client stays in Ukraine up to 10 days, starting from the date of egg retrieval till the date of embryo transfer. We do the embryo transfer on 5th day of cultivation, when the embryos reach the stage of blastocyst. And then usually the client stays for a couple of days more just to take a rest, and then they safely come back home. We provide accommodation during whole your stay. Okay, let's move forward. After the embryo transfer is performed, yes?
Sorry. Does the process differ for people who want to do surrogacy directly, or is it same for
It is a little bit different. If you talk about surrogacy programs, you may not come for the second visit.
Let me please
Yeah,
explain.
of
Okay,
course.
how it works in case we talk about surrogacy and egg donation. So if we talk about surrogacy and egg donation, so what is required from you? We need the intended mother to come and to donate the sperm. So the second visit, if the sperm is of normal quality and you come for initial consultation and we can freeze it and the lab confirms that after unfreezing the sperm doesn't lose the quality, we may actually freeze it and then before fertilization unfreeze and use for fertilization. In case of egg donation, surrogacy and egg donation is easier. If sometimes the only fresh sperm can be used, you will know about that during the initial consultation according to our lab results. So you will need to come. Literally, it will be shorter than the initial consultation. It will be only half of a day. So you will need just come. What we recommend to come to evening prior just to have some rest. In the morning, if initial consultations normally starts about 11 a.m. So the fertilizations and actual sperm donation for fertilization starts about 8 a.m. So you will be taken to be in the clinic about 8 or 8:30 or 9 a.m. according to the schedule previously agreed with the lab. And actually you will have to donate sperm to wait for the lab that confirm that everything is fine. You may go home and that's all for that day. So in case surrogacy using donor eggs, this is a less complicated scenario in terms of time. And because what Irina is telling about, it's like when intended mother is a recipient, so it's more complicated process.
So sorry, I just want to confirm. So we're following here. Is this so that the surrogacy using donor egg or IVF and
It's
donor egg?
IVF, egg donor egg. Yes, it's not surrogacy.
Yes, it's IVF, yes, correct.
Yes, we are talking about the client as a recipient.
Yes,
Absolutely.
and the donor egg.
Yes, and the egg donor.
Right.
Also, yeah, as Anastasia mentioned regarding the sperm collection, at the same time, also, yes, during initial consultation, the partner will have semen analysis done. And if the sperm quality is good, the sperm will be frozen. So for the next treatment, for the woman to come, and for example, the husband cannot come due to work commitments or etc., she can come by her own, and we will use frozen sperm material for that. After the embryo transfer is performed, you will be given the protocol to follow and the medications according to that protocol. Please do not do self-treatments. We provide all the medications in order to support your pregnancy, in order for the embryos to be implanted. Those medications are provided for 3 months period. Those medications cover all the issues such as progesterone, estrogen, vitamins. All of them are included in the package and all of them are to be followed strictly without missing any of the injections or pills. In 2 weeks after the embryo transfer period, you need to make the blood test, such as HCG test, in order to check the HCG level in your blood. After the pregnancy is confirmed, you will need to do the ultrasound in 2 weeks after HCG test in order to detect how many embryos are implanted and general information as to your babies. After that, please do not forget to send the reports to me. And since our doctors will be monitoring your program till the pregnancy reaches the term of 12 weeks. After the term of 12 weeks, our applications are considered to be fulfilled. What is also very important, not to stop taking medications at instant. For example, your pregnancy, you reach the term of 12 weeks and you decided to stop medications. No, please do not do that. After you send me the ultrasound report, I will explain you how to reduce the dosages of medications, because it won't be done at instant and that's it. The dosage will be decreasing from time, like step by step. Dosage decreasing lasts for about 3-4 weeks. So please be aware of that. Our egg donation packages. We have the economy package that covers 1 attempt, The payment should be done after you sign the contract, after initial consultation is done. We provide, within this package, we provide the medication for 1 month's period. In case selective reduction is needed, you will be charged 1,000 euros additional. In case test activity is needed, you will be charged 1,000 euros additionally. Accommodation, logistics site, driver from to airport, from to the clinic are also covered. Double egg donation program. The double egg donation package covers 2 attempts of egg donation program. We provide medications for 3 months period, and the payments are to be done 50% after signing the contract and another 50% at the day of egg retrieval. The cost of selective reduction is covered by this package. In case test activity is needed, you will be charged 1,000 euros additional. And we have the guaranteed success egg donation package that covers 5 attempts. The payments are to be done in the same way as the package for 2 attempts. 50% are paid after the initial consultation, and another 50% are to be paid at the day of actual egg retrieval procedure. We provide the medication for 3 months period as well. In case of 5 negative results, we guarantee money back, the full amount paid for this package. The cost of selective reduction is covered by the package price, and at the same as the previous packages. In case test activity is needed, you will be charged 1,000 euros additionally, since this procedure, if we talk about test procedure, this procedure is to be done in another private clinic.
Can I ask a question?
Absolutely, absolutely.
You know, you mentioned your obligations finish after 12 weeks.
Yes.
If on first, second, third transfer, a pregnancy went beyond 12 weeks but then was lost, do you just re-engage with that, or is that obligation over?
Our obligations are over after the pregnancy reaches 12 weeks. We
Even if
provide
it was number one?
Ah.
Even if it was the first one, for example, you went over 12
among the
weeks?
contract 2 attempts.
On this contract, 5 attempts. So
Yes.
if you were trying, so if the first one or the second one went over 12 weeks, in theory, if it was just less than 12 weeks, you would have 3 potential embryo transfers left.
Yes.
But because it went over 12 weeks, does that finish your obligations on 5 embryo transfers?
After in case of miscarriage, after 12 weeks, our obligations are considered to be
So we
in
would
case you
start
want to
again.
proceed once more, it will be another contract in this
Okay.
case.
Thank you.
Yes, but I would like to point out as to the miscarriages after 12 weeks. As I indicated previously, we provide medications for 3 months, but actually these medications are not for 3 months, not for 12 weeks, they are for 15 weeks. And usually, according to my practice, according to my experience working in this clinic for 2 years almost, my clients, yes, they had the miscarriage at 6-7 term, but my clients, they didn't have the miscarriage after 12 weeks. Also, important factor, well, keep it in mind, after you come back to your country, after you get positive HCD test result, my strong recommendation, please, you need to find your prenatal care specialist who will be monitoring your pregnancy, since it is extremely important. I had a few cases when the client got pregnant, but they didn't know what to do further. So my recommendation for you to have your own gynecologist, prenatal care specialist, who will be monitoring your pregnancy till the delivery.
I just want to ask, you say the medications for 3 months, is that 3 months each try?
Yes, absolutely.
How much is the first package, Irina?
How much?
Yeah.
4,950.
How much,
Yes,
sorry?
4,900.
Oh, no.
The first package, the
Yes,
first one.
4,900.
Okay.
The second package is 6,900, and this package is 9,900 euros.
Okay.
Yeah. We also have the ideal package. This is the egg donation program with possibility to move into surrogacy program. In this case, if we talk about this package, and if we talk about egg donation packages, in those cases, you may not be officially married. But for ideal package, please be aware that in order to sign this contract, you need to be officially married. Because in case you will need to switch to surrogacy program, you will need to follow all the process that Anastasia explained before.
Sorry, I missed that. So you need to be married for the unlimited.
For the ideal package. For the ideal package, that the possibility is transferring to surrogacy program.
But if you're not worried if you're not thinking of surrogacy, it's okay to be.
Absolutely. If we talk only about egg donation program, yes, there is no need to be.
Okay.
Also, I think that you may get married if the embryo stage if the embryo transfer stage, like IVF plus donor X, you sign this because it just normally, sorry for interruption.
Absolutely. You're free.
Normally, just ideal package is actually perfect for those who would like to try at least 1 or 2 tries, and before going to surrogacy stage. And while you're still in the IVF plus donor X, you may not be married, but until you are married, we will not be able
To switch.
to surrogacy.
Yes, that's absolutely correct. And yeah, ideal package is perfect for the clients who would like to try 1 or 2 times before moving to surrogacy program. So regarding egg donation part before switching to surrogacy, it is absolutely the same as with all egg donation packages. The cost of selective reduction is covered, the medications are covered, the accommodation, logistic, food, everything is covered.
So can I ask you, with that package, does it then jump to the VIP package?
It depends.
in
It
total,
depends
or-
which package you'd like to choose, because the installment that you make for egg donation program, you will be automatically transferred and it will be counted as the first installment of surrogacy program
Okay, so
already.
you just take that off the surrogacy.
Yes, so you
Okay.
won't lose any payments in this case. And yeah, actually you have an option. You can either transfer to standard package or to VIP package. It is up to you after you decide. Yes, here is the list of what our egg donation packages cover. You can see that we cover accommodation, transportation, food supply during your first visit, your second visit, and all subsequent visits if needed. Personal guidance of manager in charge of your program. It will be personally me or my assistant. Services of an interpreter, well, it is a combination of personal guidance and interpreter, which we. Egg donor services, most of our donors are Caucasian. The database contains about 500 donors with proven fertility. All of our egg donors have at least one healthy child of their own, which means proven fertility. All of them have high AMH level. All of them have been carefully screened and examined before getting into that online database. Also, all of my clients, before coming for the initial consultation, they can get, in case if they want, they can get the 2 days introductory access to our egg donor database, so they could have a picture of how our egg donors look like. Maybe make some kind of approximate list whom they like, maybe find some favorites, and then they can actually bring this list for the initial consultation already, and we can check with the doctor who's available among them already. Sperm donor service is also included in case you require the sperm donor. Initial consultation is included, as Anastasia mentioned. It is also very serious and big decision for you in order to use the egg donor. That's why absolutely you can come for the initial consultation. You will be provided with the hotel, with the driver. You will have medical examination. You will have blood tests done. You will have the consultation with the doctor. And it's not necessarily you need to sign the contract at this date. You can come back home and then make a decision. Medical consultation with a supervising physician. All the medications need for stimulation and after embryo transfer, as I indicated earlier. All medical services required for the artificial insemination, so the pickup of the biological father's sperm, the oocyte retrieval of the egg donor, the fertilization of donor oocytes, and embryo transfer into the uterine cavity on the 5th day of fertilization. So here you can see the differences between egg donation packages in order to make it more clear. Economy, standard package, success package, ideal package. But I can see that there is no indication. You see, ideal package, transfer to ideal package, yes. In case of success package, you also have the opportunity to transfer to ideal package. For example, you sign the success package, but after first or second attempt, you realize that you do not want to move with the egg donation program anymore. You have the opportunity to move to the surrogacy program as well. So, donor sperm included. In case of ideal package, it's not included since during surrogacy program, we need to use the father's genetic material. Pregnancy monitoring till 12th week of pregnancy. Of course, everything is included in case of ideal package till the birth of the baby. Embryo reduction if needed. It is covered in all the packages except economy package. Post-embryo transfer medications for 3 months period, except economy package for 1 month period. Delivery, legal assistance, paperwork, resumption, transfer, all that is applied in ideal package. Our egg donors. As to the egg donor database, actually while having the introductory access to our egg donor database for 2 days, or maybe after signing a contract already, you will see that our egg donor database contains pictures of our egg donors in 3D rotation. The egg donor database contains the short video, some kind of introduction video of the egg donor where she tells about her hobbies, her family, her education, what she likes, what she doesn't like, etc. Also, there is a short profile of the egg donor with the indication of age, weight, hair color, eye color, and education. And let's move forward. So this is like, I would like to say, a general picture of our egg donors, but when you have a chance and if you'd like to have a thorough check of our egg donor database, you are free to send me an email and I will open the egg donor database for you for 2 days to take a look at our egg donors.